Now we'll discuss very important hot topic for upcoming the AIIMS NORCET examinations. So that is sickle cell anemia. So the sickle cell anemia. Here it is an inherited genetic blood disorder. So what happens here? Abnormal HB, the hemoglobin causes RBC to become a rigid, sticky, and crescent shaped. Here it is the autosomal recessive disorder. It means autosomal means so these are the chromosomes. They not plays an important role in sex determination. It plays an important role in growth and development, metabolism, and physical characteristics. Here normal RBC lifespan is 120 days, but here in sickle cell anemia, so the 10 to 20 days is the lifespan of RBC cells. Here, what happens really in case of that is sickle cell anemia? Here the glutamic acid is so it is replaced by that is valine. So valine. Here the glutamic acid is very important. It is a hydrophilic. It loves the water. So it gives the normal round shape. So the shape to this RBC cells, it is a flexible as well as round shape. But here it is replaced by so that is valine. The valine, it is also the amino acids. So it makes the RBC cells becomes so rigid and so sticky and non-flexible. So it may causes that is crescent shaped so the RBC cells, that is we call as so sickle cell. So it may lead to the anemia, so that is we call as sickle cell anemia. Here alphabet is 1 and it is also alphabet 1. It is usually caused by the chromosomal defect in the so that 11th chromosomes. Here now come to the clinical manifestation. What are the clinical manifestations we are going to see in case of sickle cell anemia? So that is pains. It means P stands for pain, and the E is nothing but anemia. So I is icterus or a jaundice. N is nothing but necrosis of a bone necrosis. Here the S is nothing but swelling of extremities. So the hand and feet. Now coming to this, what is the most important management for so that is sickle cell anemia? Here the hydration is most important so key factor for managing so the sickle cell anemia, because dehydration is the most important precipitating factor for sickle cell crisis. So for that reason hydration is a very important role so to prevent so the sickle cell crisis. And also so the repeated blood transfusion also very important to replace so that is normal RBC cells, because here the lifespan is 10 to 20 days. For this reason, so the repeated blood transfusion also the very important. So this is regarding to the sickle cell anemia.